Thank you, Kelly, for that introduction, and happy to be here and do this interview with you today. I'm against Obamacare. I think that it's against or goes against the Constitution of the United States as far as requiring people to purchase a commodity, which health care is, and I guess we'll see what the Supreme Court thinks about it next month, but the general basis of it is forcing people to do something even potentially against their will, and I don't feel that that is right. Well, I think it's going to hinder. There are potentially some good things about it that may help patients. The requirement of providing health care for kids up to the age of 26 on their parents' insurance is probably a good thing. Taking out pre-existing conditions as a reason to disallow or prevent someone from getting health care, I think, is probably a good thing. But overall, there's way too much regulation in it. Well, heck, I don't know that anybody really knows what's in it. Congress passed it before any of them read it, and it's basically a tax. The amount of taxes that are going to be put on everybody's shoulder is immense, and I feel that is all a negative aspect for providing care. As far as physicians, there are doctors that are actually retiring, those that are older and have been in practice for a while, and they said they're just not going to put up with the requirements, and they're just going to get out. I think that's going to be negative, have a negative effect on patients and their care. So overall, I think it's a bad idea, and again, I guess we'll see what the Supreme Court thinks when they make their decision next month, as whether it's even constitutional or not. Well, insurance companies are probably one of those necessary evils. Insurance, way back when, started out to cover major catastrophes. When something serious went wrong and you didn't have the money to cover that, and it has progressed to a point where it makes the insurance companies a lot of money, and I don't think they have patients' best interests in mind, and that may not be across the board, but I think it's probably fairly general. At the same time, patients feel insurance is something that they have to have. It's and that it should cover every little thing. If they have a copay, they complain. If they have to pay too much for their insurance, they complain. It's almost an entitlement, and I don't think that's what it was initially set up to be. Again, I think for the most part, probably not. I think their bottom line is what they have in mind, how much money they can make. At least from a physician standpoint, that's what it seems like. We try to get patients some sort of a treatment, a CT scan, an MRI, a certain medication, and the insurance companies certainly don't seem like they want to provide those, and we have to do prior authorizations and jump through all sorts of hoops, and again, a lot of times they'll still deny it. The patient can't get that care unless they pay for it out of their own pocket. So from that aspect, it seems like they are not looking out for their patients. I don't think so. I'm not sure that again, it's going to fix anything. I think it's just going to cause more issues and more problems and bring more regulations about, none of which is going to help. And I don't think that's going to help the physicians or the patients. Well, there's a multitude of reasons for this. One thing is the healthcare in the United States is some of the best in the world, and good healthcare costs money. Some of the reasons for it being higher than it should be, I think, are due to the lawyers and frivolous lawsuits that are frequently brought against doctors and hospitals, and that certainly raises the cost. Insurance companies are out to make a profit, and they charge higher premiums. Obamacare is coming online, and the regulations and taxation that will come of that is going to increase the cost of health care if that goes through and becomes law. So there's a number of things. I think if we could change some of those and make some changes in the laws, things would be better, but I think those are the reasons why they're high, or some of the reasons anyway. Well, if we could get rid of the frivolous lawsuits, that would help. If we could get some of the tort reforms passed that would cap how much settlements could be to make it reasonable. If we could prevent people bringing those frivolous lawsuits, I think all of those would help. Another thing that would probably help is if the insurance companies were not for profit but were patient-owned, non-profit. That would lower premiums, lower costs, and probably provide better health care. I think that would be an option that would help as well. The other thing that potentially could help, I'm a family practice doctor, and if we had more family practice doctors across the board, we can provide a large percentage of patients' health care need and prevent them from having to go to specialists, and we charge less. If we could get, again, more family practice doctors on board, we're kind of at the bottom of the chain as far as reimbursement, and if the reimbursements were a little higher for family practice doctor, you could get more medical students to go into that field and provide care at a cheaper cost than you get through the specialists. And that's a third way that potentially could lower healthcare costs. If you're talking about Obamacare, I don't think that they will address any of them really. They're going to try to provide more health care using mid-level providers, nurse practitioners, and physician's assistants, but I don't think that that's going to give you the same quality of care that you get from a physician who's had the training and the specialization. And again, I just don't see it as being a positive in any respect. Well, from the doctors, if they're being told who to see and being told how much they're going to be reimbursed, which I think is a fear for a lot of the doctors, we're going to have less people going into medicine. The doctors that are already in medicine are going to look for other ways to make a living. Those that are older are going to retire, and so I think it's going to again affect the quality of health care just due to availability of health care, and that's going to affect patients in a negative way. Medicaid is one of those necessary programs that I think a lot of people take advantage of. It's set up to help people who don't have the funds to provide medical care, to buy insurance, and there's certainly a lot of them out there. It's set up to help them to get through difficult times, and then hopefully they can provide for themselves by their own insurance. There's too many people who get on it and stay on it and don't make any effort to improve their lives, and it's just an entitlement to them, and they expect to have it. They take advantage of it. People come in, at least in my practice, for silly things. They've had a sniffle for a day, they have a splinter, they just come in for ridiculous things that if they were paying money, had a copay, they probably wouldn't come in. And the state of Idaho, where I'm at, has actually started charging those that make a certain amount of money a $3.50 copay every time they come in. And I think that's a great way to prevent some of the abuse of just let's go see the doctor for whatever reason. So it's a program that certainly was set up to help people, and it does help some people, but I think there's a lot of abuse in the system as well for people that aren't making the effort to improve their lives and to get off of it. But again, I think that goes back to trying to provide medical care at a primary care level. Family practice doctors do that. They do it cheaper. They do it very well. And I think if we could get more family practice doctors across the country, that would be a way to decrease the cost of medical care and still provide good care. And I may be a little prejudiced in that because I am a family practice doctor, but I see that as a good way to provide care and decrease costs. Well, thank you for inviting me today, and Have a good day.